Hi everybody, I'm Dr. Thomas Su with Artlipo, and what I'd like to talk about today is skin tightening with the Artlipo method. And when we talk about liposuction, most people have heard that if you take out fat with liposuction, that you can't take out too much, or that if you do, that the skin's going to become loose, it may be wrinkly, hangy. So the general teaching in liposuction is that you shouldn't take too much fat. You should leave about half of it behind, be conservative, and that doctors are teaching in their training settings that the more you take, the more looseness you're going to get. So I'm going to tell you today that what I've discovered in doing liposuction is something that is quite the opposite. And as I tell you my story, it may sound kind of fantastic, but basically what we do is we take things very, very completely. Instead of the 50% at Artlipo, when we do liposuction, we've been doing this for a long time, over 15 years, and we take out about 80 to 90% of the fat. When you take out that much fat, and when you take it right up close to the surface of the skin, we actually get an effect that what we are seeing is that we release the skin from the fat, and that the natural elasticity of the skin is able to sock right in, just like spandex on someone who was heavy and then got skinny. The spandex would follow your body and just contract right on top of conform to the shape. So that's what's happening with our Artlipo method. We've been doing this for a long time. Like I said, 15 years. It was about maybe 3 or 4 years into doing the liposuction that I discovered that my complete liposuction was creating an effect that was actually allowing the skin to pull right up. And although this is not being taught in any kind of major teaching settings, residencies or anything, it is something that later on, after I discovered it on my own, that I was able to find a couple of chapters in different liposuction texts by a couple of Italian doctors, Gasparoni and Gasparati. I don't remember the first names, but they actually described this concept way back in the 80s, only several years after liposuction was developed. And they called it superficial liposuction. They described that if you do liposuction right up to the surface of the skin, that it will allow that skin to contract back. So even 30 years ago or 35 years ago, this information was out there. Now, why hasn't the American Society of Aesthetic Plastic Surgery embraced this information? Well, one of the things that I've come up with is just that it is a type of liposuction that requires an extreme level of skill, because when you come up right up against the surface of the skin, if you don't do everything smoothly and very controlled, it's going to be lumpy and bumpy. And I think that's what the teaching reflects out there, that you shouldn't go up there, but it's dangerous somehow, that you're going to get lumpy and bumpy results. So this is one of the reasons I think that the main establishment of plastic surgery has not embraced superficial liposuction. We've been doing it now for, I've been doing it for about 12 years. The doctors in my office have been doing it for several years now too. And we do it in all different areas of the body, whether it's the tummy, the thighs, the arms, the chin. Everything that we do is very complete, way more complete than your typical liposuction. I'm not going to say that there aren't any other doctors that do that, but there's not very many doctors that do very complete liposuction. So anyways, that's the secret. We're doing superficial liposuction. And in different types of body areas that we do, especially the arms, this is very critical. And because we see a lot of patients with a little bit of looseness, even women in their 40s have quite a bit of looseness oftentimes, that would leave their skin a little bit wrinkly. Our liposuction will cause that fat to disappear and the skin to retract up, but you can get a little bit of wrinkliness. So although superficial liposuction is a great technique, it's not going to be the end-all be-all that's going to get rid of all your loose skin. If you have moderate loose skin that many plastic surgeons would say you have to cut away, you're probably a good candidate for what we do, because our liposuction will cause it to retract up. If you have a lot of loose skin, severely loose skin, this is not going to be good for you, because although it'll pull up some, it's going to be a lot of loose wrinkly skin, and you're still going to need some type of tuck. So anyways, just wanted to share with everybody out there, how do we achieve great skin tightening? It's through this method, the Artlipo method. So thank you for watching.
Oh my goodness. Look at that difference.
Looks like a lot smaller leg, huh?
Oh my Lord, yes.
On the back side right here.
Oh my God.
Okay.
Oh my God.
Is that cool or what?
Worth it. That's all I have to say is worth it. Oh.
Okay.
Wow. Wow. That's crazy.
What?
Wow.
I'm gonna take a little bit from the back. Okay. So we see this skinny side. And we see the undone side. How are you feeling? Does it look good?
Yeah.
Okay. All right. Okay.
So different.
Did you see how much smaller you look from that one side?
Yeah.
I'll come over here. Okay. Okay. Great. And then how's that look?
Interesting.
Look good?
Yeah, it looks good.
Okay.